And I'll go ahead and turn it over to you, Dwayne.
Thank you, Allie. Just to give you a little introduction. My name is Dwayne Odle, and I work here at the Rush Memorial Hospital in Rush County, and that's located in eastern Indiana. Again, I'm a registered nurse, certified diabetes educator, as well as a lifestyle coach. I'm going to shut my video off so I can. It's going a little bit wacko on me here. Um, and but my role here is I have the privilege of working with both patients and um, both inside and outside the hospital setting. We offer a variety of educational opportunities, including both individual and group session. We provide these in person and online. Our goal is simple. We just strive to meet patients where they are the most comfortable so we can maximize learning, support meaningful and lasting health changes. We serve a rural community with a strong agricultural presence, including many farm-related occupations. Rush County is home to approximately 16,600 residents. That unique community context plays a important role in how we approach education, outreach, and support for those we serve. So today I'm going to share more with you about and talk how we can continue to support better health outcomes in our community like this, but also justifying its cost. All right, why is it advance? Uh,
You might try your
there we go.
arrow
There we
keys.
go.
Yep,
There's my arrow
there
key.
you
There we
go.
go. As all of you are aware and understand, rural population often faces unique barriers, including geographic isolation, limited provider access, transportation challenges, and lower health literacy rates. So what works in an urban environment doesn't always translate to a rural setting. By utilizing patient education, this directly addresses these challenges specific to a rural health setting, equipping individuals with knowledge and confidence needed to manage chronic conditions, engage in preventative care, and navigate a complex healthcare system is important from a organizational perspective to buy into the understanding that patient education is not merely an auxiliary service, but a foundational component of quality care delivery. By framing education as a long-term investment rather than a short-term health care cost, healthcare leaders can align educational initiatives with broader goals such as population health improvement, patient satisfaction, and financial sustainability. Additionally, rural health patients' education strengthens community ties, signaling that the organization is committed to well-being of its residents beyond the episodic clinical encounters. Here we see long-term trends in rural health uninsured rates from 2010 to 2023. Although policy changes and economic shifts have influenced insurance access over time, rural communities consistently experience higher uninsured rates compared to the urban counterparts. These gaps often result in delayed care, reduced preventative services, and a higher reliance on emergency departments. For healthcare organizations, understanding these trends underscores the importance of patient education as a mitigating strategy. Educated patients are better able to identify lower cost options, understand eligibility for assistance programs, and manage conditions before they escalate into costly emergencies. The chart reinforces why education must accompany coverage expansion efforts, as insurance alone does not guarantee effective healthcare utilization. And this slide shows Medicaid coverage trends in rural health areas, particularly in the context of the Affordable Care Act, related expansions, and state level policy decisions. Medicaid plays a disproportionately important role in rural health financing, serving as a primary payer for low income adults, seniors, and children, and individuals with disabilities. Increased Medicaid enrollment has improved access to care, yet coverage alone does not ensure optimal outcomes. Patient education is essential to help beneficiaries understand these benefits. It helps them use preventative services, medication adherence, and use the appropriate care settings. This chart also is showing changes in rural Medicare or Medicaid enrollment, underscoring Medicaid's role in both rural and access. So education enables patients to make informed decisions, adhere to treatment plans, engage actively in their care, which is especially critical in managing chronic disease that are common in our rural population. Improved adherence and self-management lead to fewer complications, lower hospital rates, and better overall health metrics. Beyond clinical outcomes, patient education enhances trust, position the organization as a reliable and compassionate partner in one's health. From a leadership perspective, education supports strategic priorities such as population health management, quality improvement, and patient satisfaction. Although education services may lack direct reimbursement, their indirect benefits, reduced costs, stronger reputation, and good community will make them indispensable to sustainable rural health delivery. If we have time during the question section, I'll give you some examples of what we have done here at Rush. Um, the got oh, here we go. Here is the case study that that ResearchGate conducted that demonstrates the tangible impact of structured diabetes education in a rural setting. Key outcomes include 22% reduction in emergency room visits, increased follow-up appointments, and stronger community partnership. These results highlight how education equips patients with a skill to manage blood glucose, recognize warning signs, and seek timely outpatient care. It also reduces ER utilization, lowers costs for both patients and providers by improving quality matrix, increased follow-up visits, which indicate better engagement and continuity of care, which are critical for chronic disease management. Additionally, partnerships with community organizations amplify programs and reach sustainability. This is just one example that illustrates how patient education delivers measurable clinical and financial value. It also reinforces its role as a strategic investment rather than a discretionary cost. Here's another study also from ResearchGate that highlights outcomes from a senior-focused heart health education program. Here, that includes a 30% increase in screenings, improved medication adherence, and higher participation in wellness initiatives. Seniors in rural health areas often face elevated cardiovascular risk combined with access barriers, education programs addressing symptom awareness, which that has problems, medication management, nutrition, and physical activity. It empowers seniors to take proactive steps in maintaining heart health, increasing screenings, enabled early detection and intervention, while better adherence reduces complications and hospitalizations. Enhanced participation in these wellness programs reflect growing trust and engagement. Collectively, these outcomes demonstrate how targeted education improves quality of life for older folks or older adults while supporting preventative care goals and reducing long-term costs on our healthcare system. Patient education in the rural health setting, despite its limited direct reimbursement, generates downstream revenue and financial sustainability. Research has shown that educated patients are more likely to schedule follow-up visits, utilize prevention services, and adhere to care plans, reducing costly complications and readmissions. These behaviors increase utilization of ancillary services such as diagnostics, therapy, and wellness programs. Improved outcomes also enhance performance under value-based care models, leading to quality initiatives and shared savings opportunities. Framing education as an investment helps leadership recognize its role in driving both clinical excellence and financial growth. This perspective is particularly important in the rural setting, where margins are thin and sustainability depends on maximizing the value across the continuum of care. Patient education, especially in the rural health setting, can be a powerful and ethical marketing differentiator. By offering classes, workshops, and personalized guidance, healthcare organizations demonstrate a genuine commitment to community well-being. Highlighting these initiatives through advertising, social media, and outreach strengths uh, visibly and visibly and does trust in our community. Education-driven marketing resonates with patients who value transparency, empowerment, and holistic care. In competitive rural health markets, such differentiation attracts new patients and reinforces loyal among existing ones. Rather than traditional promotional tactics, education-based branding builds credibility and long-term engagement, aligning marketing efforts with organizations' missions and values. It is vital that we emphasize the role of education, projecting a fostering trust, loyalty, and sustained relationships with our patients. When patients feel informed, supported, they are more likely to remain with our organization, follow care recommendations, and advocate for our services within our community. Education improves satisfaction scores, which are increasingly tied to reimbursements under the value-based models. Long-term relationships translate into repeat customers, higher lifetime patient value, and positive word-of-mouth referrals. In rural settings where the community reputation is paramount, education strengthens the social fabric connecting providers and residents. Prioritizing education thus supports both relation and financial dimensions of the organization. So here is a basic outline of sorts for implementing and evaluating your patient education program. Key steps include integrating education into care workflows, training staff for consistent messaging, leveraging digital platforms to expand this reach. Measuring success requires tracking engagement rates, adherence to metrics, satisfaction scores, and downstream revenue growth. Correlating participation in education programs with clinical outcomes provide concrete evidence of impact. Presenting data to leadership demonstrates a return on investment and supports ongoing resource allocations, and structured metric-driven approach ensures that education initiatives remain aligned with organizational goals and continuous improvement over time. It is important that your organization reinforces these central message that patient education is a strategic investment essential for clinical excellence, financial and stability, along with brand strength. Education improves outcomes, it generates downstream revenue, and deepens patient loyalty. Leadership support is critical in this, including resource allocation and integration of education into organizations' value proposition. By championing education, leaders position their organization at the forefront of patient-centered care and an evolving healthcare landscape marked by value-based models and consumer expectations. Education provides a durable competitive advantage and ensures long-term organization resilience. The key message here is basically education demonstrates a commitment to your rural community that we care about you, not just your healthcare dollars. Again, I thank you for your time, and here are some references where I pulled my information from, and I'm also going to send out I'm going to send out or Allie's going to send out a um, one page thing if you want to take to your leadership. Kind of breaks down how you should present it to them. So, especially with ROI or return on investment. At this time, oh, want to take any questions for anybody?
Not seeing any in the chat or Q&A here, but if anybody wants to raise their hand, you're also able to ask your question verbally that way. And I will go ahead and launch our final poll. Hopefully not too difficult for everybody. This time only 2 questions while we wait and see if any questions come in on the chat or Q&A.
Our program here at Rush, we've done a lot of outreach. We've partnered with our local community center that has a fitness center, and we'll do healthy living classes there um, at the community center. And then we've also worked out a deal with them when every time they show up to a education session, they get a free week membership at the health fair or at the health center. So, which helps me with retention for people to come back every week, as well as gives them an opportunity to utilize the the health center. Most of the time, I would say that, and I've had quite a few people that um, um, have went on and got continued their membership and got a membership, which helps promote that as well. Um, Also during this class time, we can look at, and I'm doing this conservatively, we can tie uh, 5 people that I know that do not attend here at Rush Memorial. They are outside the county, but they come to my classes. They've had 5 knee surgeries, 1 hip surgery. We've, again, I hate to use the word convinced, but we um, sold our services, and I've had 3 people start um, using our providers, mainly for the 340B program, but also we're also getting downstream revenue as far as the labs, any X-rays that we get. So all that stuff generates downstream revenue that we would have or not would have lost. So that just gives you an idea about what we're kind of talking about. So I mean, I guess technically I can stop sharing now, I guess.
Question that came in. I'm not sure. Somebody asked about certificate of attendance when finished. Are you referring to the educational sessions, like what Dwayne's talking about, or were you referring to this session itself, the lunch and learn session? And I guess that is a question, Dwayne. I'm glad to hear that you have some incentives like what you talked about with the fitness center. We know that that really helps drive engagement when there's food or something available to participants. But are there any kind of acknowledgments, certificates of participation, anything like that?
Yes, they do get they do. So they get a couple things. So I partnered with Purdue Extensions, and what we do, we'll do 4 weeks of either uh, food as medicine or dining with diabetes, and then they do get a participation certificate. Um, and we also midway through, I basically we will have them. We'll cook some diabetic friendly. And I hate, and again, that's a big word. Diabetic seems to be a taboo word for a lot of people. And so it's more just healthy food. And when you throw that label on there as diabetic, it kind of freaks people out. So it's healthy food, but it happens to be diabetic friendly and give them a taste. Some people want to try it, but they don't want to spend the money or they don't have the funds. So, but if they taste it, oh, hey, that's pretty good, I will more likely to try it. So, and that's something that correlates with our dining with diabetes as well as food as medicine programs. Those are I partner with Purdue Extensions on that part. So each one of those two, they get cookbooks, they get the food as medicine program at the end of the 4 weeks. They'll get an opportunity to either get like an air fryer, a toaster oven, some utensils, trying to think, crock pot. So that's all part of that thing that they do at Purdue, which is really cool.
Excellent. And I did put in the Q&A, no, I'm sorry, we do not have certificates for attending these lunch and learns. We can confirm
Gotcha.
attendance if somebody needs it for a program or anything, but we don't have certifications or certificates for these sessions. Any other questions for Dwayne while we have him? Well, I do just want to thank everybody for their time today, especially you, Dwayne, for the great information. I think very practically useful for our critical access and rural hospitals. So